Thank you very much for that introduction. It's my pleasure to be here talking about my favorite subject, healthcare reform. I remain the eternal optimist and believe that we will get a bill and that the President will sign it. It's a torturous path, I know. I would advise you to stop watching cable news. It is just full of misinformation and misleading and will confuse the heck out of you, and there are much more reliable sources for what's actually going on in the Congress. Right now, as I'm sure you're aware, there is no bill. There are a number of bills that either have gone through committee or are still in committee, but we have a long way to go in this process of sausage making in legislation. The Finance Committee, as I'm sure you're aware, which is chaired by Senator Baucus, has not finished its work. And at this point, I think Chairman Baucus's only priority is to get a bill out of that committee. And it almost doesn't matter at this point what's in it. They are going through literally hundreds of amendments every day, and discussing them and voting on them. I think there were some good votes yesterday. They voted down an amendment to ban federal use of funds for abortions, so I was very glad to see that. They also turned down an amendment that would have required all people to show federal proof of residency, and that was also, I think, was a terrible idea. A lot of people who are here legally would not be able to produce such an ID and be denied care and services. So it's a very lengthy process. I'm sure you heard that the public plan option, which has turned into one of the most contentious parts of this debate, was voted down. Both amendments that were offered by Senator Rockefeller and Senator Schumer were turned down by the Senate Finance Committee. And Baucus even voted against them, even though he is for it in the final bill, because he knows that the bill can't get out of his committee with that in there. He doesn't have the vote on that committee. That is the most conservative committee of the 5 that are considering legislation. And as I said, the goal right now is just to get a bill out of there. So the next step in the process will, once they're finished, will be for the Senate to reconcile their bill and put it up for a vote. For the House has 3 bills. They need to put those together, and then they'll have a vote. And then those 2 bills, the one from the Senate and the one from the House, will go to conference committee. And that's where the real work will be done, and that's where the White House plans next to engage in this process. And that will be a much easier discussion among the leadership in hammering out a bill. I believe the White House will insist on a public option in the conference committee, and that such a bill will go to the floor. All indications are right now that in the Senate at least, there'll be 2 separate bills, a bill that includes the financing and the public option that will be put into budget reconciliation and only requires 50 votes, with Vice President Biden being able to break a tie. And then the easy part, the part that they all agree on, the insurance regulation, will go to probably to the full Senate, and everyone expects that piece to pass pretty readily. And hopefully Nancy Pelosi will have the votes in the House to get through one package, and will go to the President's desk. So that is, we got a long way to go. There are many steps. There's many things that can go wrong, and there's also many things that can go right. But I think as citizens, our obligation is to just keep the pressure on our representatives to let them know what you want and what's important to you, because the letters that you write, the emails that you send, the calls that you make do really make a difference. It may not feel that way, but they do. So one of the things, as I mentioned, I think we can be pretty sure of is regulation of commercial insurance. This has received a lot of press. The practices of the insurance industry are designed so that they don't have to bear risk. They don't want to insure people who need to use medical care because that represents a loss to them. It's kind of crazy, but basically if you need insurance, they don't want to insure you. If you're healthy and wealthy, they're happy to insure you, because chances are you won't use much medical care, and they can make a profit off of your premiums. So we've heard lots and lots of stories about the kinds of problems people have in getting insurance, and many of these, if not most of these, will be addressed in regulation of this insurance industry. And this includes no longer allowing them to use pre-existing conditions to deny you coverage, or exclusions in your policies, or limitations on your benefits associated with with those conditions. They won't be able to deny you coverage for any reason, with the one exception of if you're here illegally, they will not sign you up. But other than that, your health status, your age, your gender, your pregnancy status, none of that can they use to deny you coverage. They will no longer be able to drop your coverage for whatever reason. Right now, it's if you get sick, they can just drop your coverage, and even though you've been paying your premiums all along while you were healthy, suddenly you don't have coverage when you need it. That will stop. They will no longer be allowed to put annual limits on how much they'll pay out for you, or lifetime limits on how much they'll pay out for you. Those caps will no longer be allowed, and they'll pay for the full cost of your care. They won't be able to rate your premiums on health status, so they won't be able to make people who have a chronic condition, for example, pay more than someone who doesn't. What they're going to do about premiums in terms of using other individual characteristics is not clear. The Senate Finance bill, as far as I'm concerned, is terrible in this regard. They would allow a range of 1 to 5 times your premium costs based on age, so that a younger person would pay 1/5 of what an older person would, or an older person would pay 5 times the monthly premium of a younger person. That's crazy. I think that's wrong, and hopefully that won't stand. They also currently can charge women more, and hopefully there will no longer be allowed to discriminate premium prices based on gender. So these questions have not been resolved. If you look at the different bills, they address them in different ways, and that probably won't be hammered out till close to the end. And these regulations will apply to health insurance policies that are offered both in the private sector as well as those that will be offered through the new health insurance exchange, which I'll explain in just a minute. The other elements of reform are all on the table, and how it turns out is pretty much anyone's guess at this point. Basically, the way the bills are all structured is how things change for you under reform depends on what you have now. So if you currently are covered by Medicaid, not much will change. In fact, Medicaid will probably be expanded to cover everyone, regardless of your family status, whether you're married or not, regardless if you have kids or not, regardless if you're a man or a woman. If you live in a family that has an income below 100% of the poverty level or 133% of the poverty level. Again, these targets we don't know exactly where that line will be drawn. But right now the Medicaid program, which is intended to cover the poor, only covers about half of them, 50%. 50% of people living below the poverty line are not eligible for Medicaid, and they certainly can't afford to buy private insurance. And if they don't get it through their job, and usually you don't have a job if you're living at the poverty level, there really are no options for you. So this will open up the Medicaid program. The controversial part of this is how much of the tab the states have to bear. Right now, on average, states pay about 50% of the costs for Medicaid beneficiaries, and the federal government pays the other half. But the states are in pretty dire straits because of the economy, and they don't want to suddenly, literally, it'll be doubling the rolls for their Medicaid population. And for many states, this is already the biggest budget item they have. So in some of the bills, the feds say for the first certain number of years, the feds will pay the full cost for the expansion. This is, again, all up for negotiation, and we don't know quite how it will turn out. But I think the intent is to open it up to everyone who is below the poverty level.